Good morning, everyone. My name is Bharti Chauhan, and I'm working as an assistant professor in the College of Pharmacy. Today, I'll be delivering a video lecture on topic antibiotics. These are the contents of my today's video lecture that I'll be sharing. So, what is antibiotics? We should know already about this. Are the substances derived from microorganisms or produced synthetically that destroy or limit the growth of living organisms? A drug used to treat bacterial infection, and antibiotic we all know does not have any effect on viral infection because the virus basically doesn't contain a cell wall. So bacterial infection will be treated on the basis of the cell wall synthesis by stopping that. And further on, originally an antibiotic was a substance produced by one microorganism that selectively inhibit or kill the growth of the substance. So on the basis of 4 parameters, we discuss the classification of an antibiotics, which are based on spectrum of activity, based on source of origin, based on mechanism of action, and based on the chemical structure. First, on the basis of the spectrum of activity, are the classification are divided into parts, which are narrow spectrum and broad spectrum. So, narrow spectrum antibiotics are the high degree of selectivity towards single species of microorganisms, which are, you can say that particular antibiotic can show their effect on any which are gram-positive bacteria, can kill the or stop the growth of gram-positive bacteria only, or can show its effect on gram-negative bacteria. So this is the narrow spectrum antibiotics. Examples are nystatin and bacitracin. Second class is broad spectrum antibiotics. It means that this particular antibiotic will show its effect on both the gram-positive and gram-negative bacteria. I'll share about that in later slides. What are these? And for the definition, here it is. They inhibit the growth of gram-positive and gram-negative bacteria, including different species of microorganisms. Examples are tetracycline and chloramphenicol. Next, on the basis of the sources from which antibiotics are obtained, are classified as first natural antibiotics that are obtained naturally and directly from any plant extract or anything root of that or fungus, right? So they are obtained from the fermentation of microorganisms, example bacitracin and polymixin. Second is semi-synthetic antibiotics that are produced commercially by addition of a chemical agent to produce final product, example penicillin C or V. Third is synthetic antibiotics that collectively or synthesized only in the labs, right? Which antibiotics which have purely synthetic origin. It means they are synthesized in pure laboratories. Example, chloramphenicol. Next, on the basis of mechanism of action, first is drug that interfere with biosynthesis of bacterial cell wall. Here, these 4 types are classified in which the antibiotics first inhibit the bacterial cell wall. They can show its mechanism of action on the basis of by inhibiting the cell wall synthesis. Second, they act on the cytoplasmic membrane. It means the ribosomes, right? Third is protein synthesis, and fourth is nucleic acid. So in first part, the drug that interfere with biosynthesis of bacterial cell wall, example cephalosporin, penicillin, biomycin, and cycloserine. Second, drug that interfere with the functioning of cytoplasmic membrane, example nystatin, amphotericin B, and polymixin. Third is drug that interfere with the protein synthesis of bacteria, example chloramphenicol, erythromycin, aminoglycoside, and tetracycline. Fourth, last is the drugs that interfere with the nucleic acid biosynthesis that produce or that create the DNA or RNA of the particular bacteria. Example are actinomycin, griseofulvin, rifamycin, and mitomycin. So these are the classification. And last, on the basis of chemical structure, it is divided as first beta-lactam antibiotics, drugs that contain a beta-lactam ring in its structure. And its examples are penicillin, cephalosporin, monobactam, and beta-lactamase inhibitors. Second is aminoglycoside antibiotic, drug that contain a sugar moiety with amino groups. Example, streptomycin, gentamicin, neomycin, and kanamycin. Third is tetracyclines that contain four cyclic structure in its compound, in the compound, which are chlor-tetracycline, oxy-tetracycline, and doxycycline. Fourth is peptide antibiotic, drug that contain amino acid group with peptide bonds. Example, bacitracin, amphotericin. Fifth are macrolides, drug that contain monocyclic ring in its structure with lactone group. Example, erythromycin and azithromycin. Sixth is licomycin, drug that contain more than 16 atom in its structure. Example, licomycin and clindamycin. And further on, these are the classification that I have discussed with you. Now about the history of antibiotic, we should know where it all started, right? On when we take its name, when we remember antibiotic, there is a scientist which is associated with this is Alexander Fleming. What was his discovery and how he encouraged penicillin in market is now we will discuss. So first, antibiotics have been used for millennia to treat infection, although until the last century or so, people did not know the infection was caused by bacteria. Whereas molds and plant extract were used to treat infection by some of the earliest civilization in ancient Egyptian, or you can say in Chinese medicines, they already been treating the bacterial infection according to their learnings or the you can say the ancient people that have discovered something, right? For example, moldy bread to infected wounds. And here we can treat chickenpox with the help of neem extracts. What we do is we make a neem extract, right, and applied on all over the body that can produce a cooling effect on the chickenpox area. Next, it wasn't until the late 19th century the scientists began to observe antibacterial chemicals in action. So here is the first other cells. Next, in 1909, he discovered that a chemical called arsphenamine was an effective treatment for syphilis. This became the first modern antibiotic, although Ehrlich himself referred to his discovery as chemotherapy, the use of chemical to treat any disease. Right. Then further on, the word antibiotic was first used over 30 years later by the Eukaryan American inventor and microbiologist Selman Waxman, who is in his lifetime discovered over 20 antibiotics. Next, the biggest discovery of penicillin was done by Alexander Fleming. We all know about this, that they noted as an unexpected, uh, or you can say an accidental discovery we can use here is serendipity. So, upon returning from a holiday in Suffolk in 1928, he noticed that a fungus, Penicillium notatum, had contaminated a culture plate of Staphylococcus bacteria that he accidentally left uncovered. The fungus had created bacteria-free zone wherever it grew on the plate. Now, Fleming isolated and grew the mold in pure culture. What he has done to confirm this discovery or this accidental serendipity, we can say, he done a pure culture in another media and use that Penicillium notatum fungus on the particular area, and in and then he found out that Penicillium notatum proved extremely effective even at very low concentration, preventing Staphylococcus growth even when diluted 800 times. It was less toxic than the disinfectant used at the time. Here he discovered that by diluting the Penicillium notatum, diluting it by 800 times, its potency wasn't decreases. It means it was very potent, right? So after early trials in treating human wounds, collaboration with British pharmaceutical companies ensured that the mass production of penicillin, the antibiotic chemical produced by Penicillium notatum, was possible. So following fire unexpectedly arrived in the area so in which nearly 500 people died, but many survivors received a skin graft which are liable to infection by Staphylococcus. What happened here is in USA, Boston, there accidentally a fire arrived. Then what happened? Uh, for treating their skin, we use skin grafts. Skin grafts is replacing the dead skin uh, over the body that was replaced with a fresh skin or by donor skins. So, to prevent the infection of that bacterial infection on that area, they used penicillin and it was shown a big success in the treatment. And next, treatment with penicillin was hugely successful, and the US government began supporting the mass production of the drug. By D-Day in 1944, penicillin was being used in the, you can say, World War II, and by treating troops or on fields or on a hospital throughout Europe was uh, being used. Now, this was the history, and now you should know what is difference between bactericidal and bacteriostatic. What are bacteriostatic antibiotics? Bacteriostatic antibiotics are those which inhibits the growth of the bacteria, right? And bactericidal antibiotics are those antibiotics that kills the bacteria. So this is the basic difference. Bacteriostatics inhibits the growth only by not killing, and bactericidal kills the bacteria. So now these are the example. Bacteriostatic antibiotics are tetracycline, actinomycin, sulfonamide, macrolide, chloramphenicol, and trimethoprim. And bactericidal antibiotics are penicillin, cephalosporin, fluoroquinolone, glycopeptide, and monobacter. Now classification I have already discussed with you. Now I will give a overview about the gram-positive and gram-negative bacteria here in short. Gram-positive bacteria contain a thick peptidoglycan layer, and gram-negative bacteria does not have a thick, but it was thin, single-layered peptidoglycan layer. Now, teichoic acids was present in gram is present in gram-positive and absent in gram-negative. And other than this, lipid and lipoprotein content is very low in gram-positive bacteria and is very high in gram-negative bacteria. So these are the basic introduction about that. Next, beta-lactam antibiotics. What are beta-lactam antibiotics? Basically, you can see in the structure below, there is a red highlighted area, red ring, you can say 4-numbered ring. This is a beta-lactam ring. And on the basis of chemical structure, the name was given as beta-lactam antibiotics. Well, now the definition is beta-lactam antibiotics are antibiotics that contain a beta-lactam ring. Here you can see in their molecular structure. This include penicillin derivative, penam, cephalosporin, monobactam, carbapenem, and carbazepam. Next, about the classification, beta-lactam antibiotics are divided in 4 classes, which are penicillin, cephalosporin, carbapenem, and monobactam. Penicillin, these are the drugs that fall under this class, and cephalosporin is further divided in 4 generations, which are first, second, third, and fourth and fifth, which we have been using right now, and these are the drugs. What is penicillin? Penicillin, I have already discussed about the history of that, and is a secondary metabolite produced by certain bacteria, which is used an antibiotic and is being using. We have been using penicillin as an antibiotic in wide range. History, I have already told you that 1928 Alexander Fleming has been discovered the penicillin by serendipity. And 1939, what happened is they isolate and synthesize large amount of penicillin. And 1941, this was introduced in antibacterial therapy. 1944, penicillin has been at the disposal of all people. It means it was used in a wide range. Classification, if we talk about the classification, It is divided in first is natural penicillin, penicillin G, and penicillin VK is only the penicillin that falls under this class. Second, beta lactase resistant penicillin, aminopenicillin, carboxypenicillin, uridopenicillin, and penicillin inhibitor combination, carcinosin and picarcin. This is the basic structure of the penicillin you can see here. First, 5-member ring, which is called thiazolidine ring. It contains a sulfur group. Second is carboxylic group is attached on the third position of that thiazolidine ring and fused with the beta-lactam ring. And fourth is acyl aminocytosine that is attached to the sixth position of the beta-lactam. Now, on the basis of structure, you can see here you can see there is a R. It means the substitution will occur only on the sixth position of its structure, and on the basis of the substitution, the activity will be varied. Penicillin G contain a benzyl group at the position of R. Penicillin B contains a methoxy or oxymethoxy group. And if we talk about penicillin B and G, these are the only natural penicillin and effective against the gram-positive and less effective against gram-negative bacteria, used in the treatment for tonsillitis, anthrax, rheumatic fever, streptococcal and skin infection. And penicillin B is narrow spectrum, should be given orally, prone to beta-lactamase. Penicillin G, which is called benzyl penicillin, is narrow spectrum antibiotic primarily to gram-positive bacteria and few others active against streptococcal. And here is the difference between these is basically penicillin G is a natural penicillin. Only this is a natural penicillin. But we also include penicillin B because penicillin B is synthesized with the help of penicillin G. It means we have done some modification to the structure of penicillin G, then we have acquired penicillin B. That is why we also include penicillin B in natural penicillin, because the structure similarity is very similar. Right, penicillin G is a natural penicillin that is produced directly from fermentation of Penicillium chrysogenum. Penicillin B is a derivative of penicillin G, and because of similarity in spectrum of activity is considered a natural penicillin. So about the chemical degradation of penicillin, here you can see first what happened here is when we do the when we uh, react the penicillin in acidic solution, then it degrade into penicillinic acid and the beta lactam ring is breakdown here and it forms penicillinic acid. Further, when we do the hydrolysis of this structure, it forms panellitic acid. Further on breaking down, its form two compounds which are panellitic acid and penicillamine. Also, when we do the hydrolysis of penicillin, it forms penicilloic acid. Further, by decarboxylation of the penicilloic acid and providing a heat, it produces penicilloic acid. Further, when we do the hydrolysis of penicilloic acid, it forms penicilloaldehyde and d-penicillamine. Next, SAR of penicillin. This is a very important part. If we talk about medicinal chemistry, SAR is structure activity relationship of any structure that we discuss on as when we do any substitution at the part, then how it affects on the activity of that compound, how it will increases or decreases or increases its onset of action or any other parameters. Here in position 1, we can see it's sulfur. When we do the oxidation of the sulfur, it forms sulfur oxide or is converted into sulfur. But what happened here is it decreases the activity of the enzyme. So we cannot do the oxidation of this compound. It is good as it is now. At the position 2nd, there is a dimethyl group. When we do another substitution of this compound or we replaces this dimethyl, the activity will be low. At the 3rd position, there is a carboxylic acid present, and when we do replacement of this group with alcohol or ester, the activity will be decreased. At position 4, the nitrogen group is must for the activity as an antibiotic. Position 5, here no substitution is allowed, or if we do any other substitution on this position, the activity will be decreased. At position 7, here carbonyl group is present, but which is important for the activity, so no substitution is necessary for the compound. At position 6, where all the substitution are going to happen, here electron withdrawing group. If we add an electron withdrawing group at this position, it will give the compound better acid stability, because this substitution will make the amide oxygen less nucleophilic. So if we are talking about acid stability, it means that the compound will not be getting degraded when it reacts with our stomach acid, right? So we can take the drug with oral administration. You can take the oral administration of the drug that we have synthesized, that we have improved its acid stability by substitution. A bulky group added close to the ring will make the compound more resistant to beta-lactamase. Steric hindrance provides protect to the beta-lactam ring. So this is the SAR I have explained with you. Here in stereochemistry, you can see there is a 3 chiral carbon present at 3rd, 5 and 6. C3, C5 and C6 are the 3 chiral carbons which are present in the penicillin structure. Chiral carbons are those carbons that have different group present in its 4 attached substitution. So about the mechanism of action of penicillin. Penicillin and other antibiotics in the beta-lactam family contain a characteristic 4-member beta-lactam ring. So basically, it acts as inhibiting the synthesis of a cell wall, of bacterial cell wall. How it inhibits? There is a enzyme which is DD transcriptase. It works as an cross-linking the peptido chain that is present on the cell wall. So by inhibiting the DD transcriptase enzyme, we can inhibit the cell wall synthesis, and furtherly, if the cell wall will not be connected or cross-linked accordingly, then there will be a presence of a small holes between the cell wall, by which the outer water will get inside of the bacterial cell, and further on, when this happens, the cell will be burst and it will show its bacteriostatic or bactericidal effects. Now, what is beta-lactamase enzyme? I have talking about how beta-lactam ring will bind with the transcriptase enzyme and show its activity. But here, bacteria is also playing very smart. It generated an enzyme which is called beta-lactamase, right? So what it do here, it breaks down the beta-lactam ring, which is important for the antibacterial activity. So beta-lactamase enzyme are enzyme produced by bacteria that provide multi-resistance to beta-lactam antibiotics such as penicillin, cephalosporin, and anthrax. Now, what happened here is beta-lactamase enzyme, which are produced by bacteria, is degrading the beta-lactam ring of the antibiotics. So after that, scientists also discovered the counteract of that beta-lactamase enzyme by creating a beta-lactamase inhibitors. So here's the definition. Beta-lactamase are a family of enzymes involved in bacterial resistance to beta-lactam, but the inhibitors will act on by suppressing the beta-lactamase enzyme activity, so the antibiotic can show its potency at the highest. Here is the one example of an inhibitor, which is clavulanic acid. We all know clavulanic acid is doctor prescribed it with the combination of amoxicillin. So it acts as bind strongly to beta-lactamase enzyme or near its active site, thereby hindering its enzymatic activity. This protects other beta-lactam antibiotic from beta-lactamase catalysis, thereby enhancing their antibacterial effects. So this is the clavulanic acid structure is a semisynthetic beta-lactamase inhibitor isolated from streptomycin. Thank you so much for patiently listening my video lecture today. I hope you have found this relevant. Thank you.